Fantastic. Brilliant.
They survived COVID and are still piecing together what happened during their stay in intensive care.
Good. If you can bring your weight forward, Jeff.
They'd shaved my beard off because I had I was on the ventilator, I had tubes in my mouth. The first time I saw a picture of myself, I didn't recognise myself.
I know I was delirious quite a bit throughout, the sense of drowning all the time, that I was floating on top of the water and I was watching the doctors.
He can open his eyes.
These are some of the video diaries sent to Jeff Austin's family to allow them to see his progress.
He's doing really well.
You're still on the ventilator, but you're a lot more awake and squeezing my hand and sticking your tongue out.
Together with the diaries kept by ICU staff, they're helping the 70-year-old to fill in the gaps of lost time.
I have quite a long scar there for a tracheostomy. I still got a bit of a husky voice now. The speech therapist said, try not to strain your voice, and told me not to sing. Before I retired, I was a pastor, and we used to sing all the time in church.
Karen McCartney was treated in the same intensive care unit as Jeff. She also spent weeks there, celebrating her 56th birthday with nurses.
When I came out of the ICU, my sister was actually waiting just outside the ward. And that in itself, that was when I knew that I was going to survive, basically.
For Jeff and Karen, their rehabilitation started in intensive care. Once home, a 5-week programme called Inspire aims to help patients navigate the services needed to aid their recovery. This multidisciplinary support has been adapted during the pandemic, with many sessions now online.
It was never resourced for the number and volume of patients that we're going to see right now and for the next year ahead. I see our job is to allow patients and families to recover the best they can so that they can thrive, not just survive.
On returning home, Jeff and Karen had very different experiences.
There was a GP, a physio, speech therapist, in fact, two physios.
For 2 weeks, I had no contact with anybody at all. I did think that all that work that these guys had done to nothing. Mentally, I don't think it was a good place to be.
Karen's district nurse helped her to access the care she needed. The Scottish Government says over the next 3 years, £4.5 million will be invested to meet the increased demand for rehabilitation and mental health services. Another lifeline for patients is the charity ICU Steps. Currently, it only has 2 groups in Edinburgh and Dundee. It now plans to create a national network of peer support.
What we find is that GPs often know very little about the psychological after effects of critical illness. So, patients can feel really quite alone. And for many of them, it's a huge relief just being able to share experiences with people who've been through something similar and to feel understood.
The support should be there for people. We shouldn't just be let out of hospital and just left to our own self-pity, because a lot of the time I did, to be honest. I still get my husband to cut up my meat because I can't use my hands, I can't make a dinner, I can't really look after myself, and that's after all the 3 months down the line.
I've actually come quite a long way in a short time compared to other folks.
Okay, right, we'll go to sit down, ready.
I need to recognise that or appreciate how far I've come.
With the help of an Inspire recovery coordinator, Jeff hopes he will regain the power of his voice. Peer support is giving other ICU survivors the strength to find theirs. Sharon Frew, STV News.